Hey curious minds, are we facing another pandemic? Hospitals in China are overwhelmed, and social media is buzzing with alarming images. But this time, it's not COVID-19, it's something called Human Metapneumovirus, or HMPV. So, what's going on, and should we be worried? Let's find out if experts consider it the next pandemic after COVID. Let's start with the basics. What exactly is HMPV? HMPV is a virus that typically causes mild upper respiratory infections, very similar to the flu. If you've ever had a cold with symptoms like a cough, fever, or nasal congestion, then you've probably experienced something pretty close to what HMPV causes. It was first identified back in 2001 in the Netherlands, but it's been circulating around the world for decades now. So, how does it spread? Like many respiratory viruses, HMPV spreads through direct contact, think handshakes, or touching surfaces where the virus might have landed. And yes, it can spread when someone coughs or sneezes, just like the flu. Now, recently, there's been a surge in cases of HMPV in places like Beijing, especially among children. You might have seen photos of hospitals overrun with people wearing masks, and that's raised alarms. Could this be a sign of something more dangerous? Should we be preparing for another global health crisis? Here's what experts are saying. While HMPV is on the rise, it's important to remember that this virus is not like COVID-19. In fact, experts say it's not even a new virus. It's been around for years and we're just seeing a seasonal spike. Just like flu cases rise in winter, respiratory illnesses like HMPV also tend to increase during colder months. But it's not all calm waters. Some groups, like very young children, especially those under the age of 2, and people with weakened immune systems are more vulnerable to the virus. For them, it can cause more severe symptoms like wheezing, breathlessness, and even pneumonia, which might require hospital care. You might be wondering, what's driving this sudden rise in HMPV cases? It's actually pretty simple. HMPV is more active in late winter and early spring. Experts believe the cold temperatures help the virus survive longer in the environment, and let's face it, people tend to spend more time indoors during this season, creating the perfect conditions for the virus to spread. And it's not just China. Other countries like the US and the UK have also seen increased cases since October of last year. It's all part of the normal seasonal cycle. So, with all this talk of spikes and hospitals filling up, you might be wondering, is this something we should be worried about? The short answer is no. Experts stress that HMPV is not a new pandemic threat. Unlike COVID-19, which was caused by a novel virus that no one had immunity to, HMPV has been circulating globally for decades. In fact, almost every child has been infected with HMPV by the time they're 5 years old. So, most people have some level of immunity to it already. Dr. HSU, an infectious disease expert, explains that while the virus can cause more severe illness in high-risk groups, it's not a global health emergency. So, there's no need to panic. But of course, it's always a good idea to take some basic precautions, especially if you're in a high-risk group. Dr. HSU suggests simple steps like wearing a mask in crowded places, practicing good hand hygiene, and staying away from large crowds when possible. Oh, and if you haven't already, getting your flu shot is another way to help protect yourself from respiratory illnesses this season. So, there you have it. HMPV might be making the rounds, but it's not something to lose sleep over. The spike in cases is a normal part of the season, and with the right precautions, we can stay safe and healthy. If you want to learn more about HMPV or any other health topics, be sure to hit that like button and subscribe for more updates. Meanwhile, HMPV may not appear that dangerous, but another alarming medical disaster is making headlines. A 53-year-old surgeon in Germany was diagnosed with cancer in an extremely rare and extraordinary incident of transmission during surgery. It's almost unbelievable that cancer could be transmitted through contact with a cancer patient. In this video, we'll break down what happened and why this is being called a medical disaster. The surgeon was operating on a 32-year-old patient to remove a malignant fibrous histiocytoma, a rare soft tissue cancer affecting only about 1,400 people annually. During the procedure, the surgeon accidentally cut his hand. Although the wound was immediately disinfected and bandaged, it became the site of an unexpected development. 5 months later, the surgeon discovered a lump at the injury site. Medical tests confirmed the lump was a malignant tumor, genetically identical to the cancer from the patient he had operated on. The patient, unfortunately, passed away from complications after the surgery. Doctors concluded that cancer cells from the patient's tumor had entered the surgeon's bloodstream through the cut, leading to what they described as an accidental transplantation. Unlike organ transplants, where the immune system often rejects foreign tissue, the surgeon's body failed to recognize and destroy the cancer cells. Researchers believe the tumor evaded the immune system through molecular alterations that allowed it to grow undetected. This ineffective anti-tumor immune response made the case particularly unique and medically significant. This case, first reported in 1996 and recently revisited, is believed to be the first of its kind. It highlights the rare possibility of cancer transmission during surgery, a phenomenon with no established statistics. The findings were published in the New England Journal of Medicine. While the surgeon's tumor was successfully removed and no recurrence was observed after 2 years, the case underscores the importance of strict safety protocols during oncology surgeries. Typically, the immune system aggressively rejects foreign tissue, as seen in organ transplants where patients require immunosuppressive drugs to prevent rejection. In this case, the cancer's ability to bypass immune defenses adds to our understanding of tumor biology and immune response failures. Though such cases are exceedingly rare, they emphasize the critical need for immediate care of surgical injuries and ongoing research into cancer transmission and immune responses. This remarkable case serves as a stark reminder of the complexities of cancer and the risks faced by medical professionals in their line of duty. Don't forget to like, share, and subscribe our channel The Research Mind for more fascinating stories.
Thanks for watching. Please, check out our video about a miracle drug that is enhancing human life by 25%. It also improves health by minimizing wrinkles and even reduce chances of cancer. Researchers from the Medical Research Council Laboratory of Medical Sciences and Imperial College London have made an amazing discovery that could change how we think about aging. They found that blocking a protein called IL-11 can make mice live almost 25% longer in good health. And this discovery might one day help humans too. If you found this video helpful, don't forget to like, share, and subscribe for more science updates and breakthroughs. If you found this video helpful, don't forget to like, share, and subscribe for more science updates and breakthroughs.